Hi, Lisa. How are you today?
I'm doing well, thank you.
I'm so excited to have you on the platform to really tell your story. Why don't we start by you telling our viewers a little bit about yourself?
Well, I'm almost 60, and that's a milestone in a good way. I have no problem saying my age. I'm a emergency and critical care veterinarian. I've been practicing for about 34 years or so. Um, I live in Philadelphia, and this is where I was born and raised. But I haven't lived here for almost 40 years, and now I'm back home, which is a great thing. Um, And I am so far a survivor of stage 4 colon cancer. Yeah.
Yeah, that's amazing. Survivor, thriver, right?
I
Yeah.
try to. I do try
Yeah.
to. I try and do everything I can to keep myself healthy and such. And I'm not a long survivor. I mean, I am, I guess. I was diagnosed 5 years ago, and I have not received any treatment since December of uh, 2020, I guess, or 2021. Yeah, I know I'm over 3 years, so I guess I'm going into almost 4 years of
Yeah.
no treatment and being free of cancer that we're aware
Yeah, that's amazing. That calls for a celebration. I don't have any bells but yes, I want to like celebrate. That's amazing. Every milestone, every year, every day, every
of.
month is definitely a reason to celebrate. And can you tell us about your diagnosis? What symptoms were you having prior to going in? What was that whole process like for you?
Yeah. I actually didn't have many symptoms. I was training for a triathlon, and I've always, well, not always, I didn't start running until I was 48 years old.
Wow. There's
And
hope. There's hope for me.
yeah, I didn't start running, doing half marathons or triathlons or anything like that until after I was in my 50s when I was 50 or earlier than 50 when I did my first half marathon. And I was uh, 54, I guess, when I did almost 55 when I did my first triathlon.
Wow.
54 when I did my first triathlon. But either way, I was training for a triathlon, the sprint, which is the shortest distance that you have in a triathlon. So you're swimming about anywhere from 400 to 600 meters. You cycle 10 to 12 miles, and then you run a 5K. And it was actually during me training for my cycling portion that I noticed every time my leg would come up in pedaling in rotation, I would feel a twinge in my lower right groin. Not like muscle, it was distinctly in my abdomen. It wasn't really in the groin. Yes, I was losing weight, but I again was training.
Mhm.
So the weight loss wasn't drastic and it wasn't unusual. I had no other GI signs at all, at all. Appetite was great. Energy level was great. There was nothing like that. So, uh, as I was training and I kept feeling this twinge and I could actually press on my abdomen. I didn't feel mass, but I would feel a distinct discomfort every time I pressed in the same exact spot. FYI, that should never happen. You should never press anywhere in your body and always get a pain when you press somewhere unless you know you've bruised something. But
Mhm.
even then, that lessens over time. You should never consistently get a pain. I'm stating that because I'm a veterinarian, a doctor, but I know you shouldn't always get the same thing. Anyhow, um, I think I had finished my triathlon, and I had gone to my doctor and said, "Hey, this isn't right. I shouldn't feel this." They were concerned I still had my appendix. They were concerned could I have an appendicitis, and they actually sent me immediately. to go get a CT. I didn't have any other signs of appendicitis, fever, um, nausea, nothing. I got the CT, and the CT just said, "Oh, you have colitis," and they put me on medication. Told me to see a GI doctor. I did. While still on the medication, he asked me how I was feeling. I said, "Well, I do feel a little better. The pain is a little less," is what I'd said, because I didn't have any other signs. And they said, "Okay, well, we can go ahead and set you up with a colonoscopy pretty much now, or we can revisit in a month." Um, I was like, "Okay, well, why don't we kind of do this now?" And actually, I did wait a week. I had a anniversary celebration with some friends from college, my line sisters from college. It was our 35th anniversary for our line, and we were going to Savannah. So I'm like, can't do it this week. I gotta when I get back.
Priorities, right? Yes.
But as soon as I got back, I did. I set it up, and I did it as soon as I got back.
Mhm.
And of course, you remember these kind of moments and these dates and things like that. And it was July 18th, um, 2019. And yeah, 2019, because no, um, actually, yeah, it was. I guess it was July 19th, 2019, July 18th. And I did a colonoscopy, and it wasn't the first colonoscopy I've had. I actually, by this time, I'm already almost 55, so I had already had one at 50 or whatever. I had actually had one 18 months. I can tell you, I was only 53 or so. 18 months before this one, I had had a colonoscopy.
Wow.
He I wake up from my colonoscopy, and you guys, if you've ever had one, you know that they're pretty brief. You wake up pretty quickly. I woke up, and the doctor who was doing the colonoscopy is actually standing beside the bed. And that hadn't happened with my first one. Um, and he's standing there beside the bed, and it's not a nurse. And he just looked straight at me, and he says, "I'm really sorry to tell you this, but I'm almost 100% positive I found cancer." He said, "There's really nothing else that this mass could be. Uh, it is a mass in your colon. It is being invasive. And I'm sorry to say that." So that was a gut punch. And, you know, I don't think there was any way for him to break it any nicer or anything like that. People were like, "Oh, so blunt. He was right there." I was like, what was he going to do? I mean, it was obvious. He said, "I don't have any tissue samples." He said, "But I'm looking at this, and there's nothing else that this could be." I appreciated his honesty and not sugarcoating anything. Um, he said, "We need to set you up to have it removed. And at that point, we will figure out where things are and what's going on." And of course, in that meantime, I actually started doing research on my own of the different stages of colon cancer. I actually had an uncle that was not blood. Um, he was my mom's brother in law. So, and he died from gastric adenocarcinoma. I knew what that is. I knew what the life expectancy for a gastric adenocarcinoma was. Mine was in my colon, his was in his small bowel, but still, I know the life expectancy is 5 years. I didn't know what it was for colon cancer. But I looked it up, and low stages could be curative, more or less. Stage 4 could be 6 to 9 months, depending on where it is and how it is. So I was fortunate that he set me up with a surgeon who, fairly young, had just recently moved down to Florida from Mount Sinai. I think his family was from there, but anyhow, he had come to this hospital. Um, and one of the things that he had been doing at Mount Sinai was um, gastric cancers and GI cancers is his form of surgery. And his name is Dr. Chanel Bagwadin. And I believe that he saved me um, in his honesty and in what he did and how he approached my cancer. Um, from the beginning, he was optimistic. He, and that helped. That really does help because even with finding this before we knew the stage, he was optimistic about what could be done and how you handle it. But he didn't sugarcoat things either. He was straightforward and appreciated that. And I didn't even look for a second opinion. I was comfortable enough with him, which is rare for you to find the first one. So he took me to surgery and he removed the mass, which was a good 2 inches, but he removed 18 inches of my colon. Um, we found out that it was stage 4, regardless of my lymph nodes, because it had already invaded outside of my wall, outside of my colon, and had adhered itself to my abdominal wall. Now, why is that key? I had no other clinical signs. By adhering itself to my abdominal wall, that's why I felt it. That's why I noticed something was wrong. Had it not done that, even though it was stage 4, had it not done that, I would not have found it when I did. I wouldn't have found the signs. I wouldn't have pursued help. Um, and I probably wouldn't be here today. Uh, so he did that. He removed 18 inches of my colon. He removed 27 lymph nodes, and of the 27, only 5 of them came back positive for concern of cancer. He did have to remove a small amount of my abdominal wall. But that's when I was diagnosed as stage 4. And you hear stage 4 cancer, period. And it's not so much your life flashes before your eyes. I don't know what that feels like, but you become, you become concerned for what happens next. What about my children? And my children weren't young. One was in college, and that was my youngest one. And my oldest one was in Ohio, living on his own. So they weren't babies, but still, they're still pretty young. And it's like, what's going to happen? And then, I mean, I love my husband, um, we've known each other for a long time. We met in college, didn't really date then too much. But, he's my best friend. He's my partner. I wasn't ready to leave him. I had a father who was ill at the time, and my mother's still alive, my siblings, and I wasn't ready to leave any of them. And I didn't want them worrying about me. Honestly, that was a lot of it. I was in Florida, nowhere near my family, except for my immediate, I'm there with my husband. But my siblings I'm extremely close to, and my parents, and I didn't want them worrying about me. So actually, we held off telling them until we had the tissue diagnosis. I didn't say anything. They didn't, I don't even know if they knew I had the colonoscopy at that time, anyhow. Um, my surgery was good, and good signs. 5 lymph nodes involved. We removed it. He didn't see anything else obvious at the time. Uh, I recovered, and then he put me in touch with an oncologist, and my oncologist was good. Uh, she actually is a cancer survivor herself. Um, but she was good, and she said, these are the things that we can try. And she talked me through everything and gave the approach and said, let's, go forth with things. And it was good. Um, she gave me all the information. I'm somebody that I wanted to read, different things. I know enough about science. I wanted to read about the different uh, drugs that were being used. I The form of chemotherapy that's used with colon cancer, you don't lose your hair. That's the only thing that they say, Other than that, you can have side effects from chemotherapy. You can have GI and loss of taste and weakness and all of those things. It's just you don't lose your hair in this particular form because of the type of cells that the cancer actually attacks. I didn't lose my hair. I didn't have the side effects either. I had tiredness. I was definitely tired at times, particularly in the beginning of the treatments. Um, but as my treatments went on, I would get up, and depending on when my treatment was, I would go to work and then go have chemo. And if I felt like it, I'd go back to work. Um, or, I would get up and I had to have the chemo first, and then I'd go into work. I actually had a form of chemo that was an infusion over about 48 hours. Well, 36, I guess, 36 to 40 hours. So I had a um, infusion pack that I had attached to me, and I would go back to work with that infusion pack on. It was small. I didn't really care about it. Um, it didn't stop me from doing anything. I chose to have a port placed. Um, I have to remember where it is. I still have it though. Uh, Rather than them place a catheter each time I needed chemo. Not that I'm scared of needles, but it's just like this is so much easier. So it was easy for me. It was unobtrusive. I carried it around. It was not a big deal. And I guess that was part of it too, that I chose not to acknowledge that it was a big deal. Now, had I had side effects, sure, that would have been a lot different. My approach to it might have been a lot different. My continued attitude about what I could do or what I couldn't do probably would have been a lot different because of how it was affecting me. But I was fortunate in that it didn't. Um, I've had a total of 3 surgeries. My second surgery was because a few months after the first one, I had the first surgery in August 15th. I had my second surgery in March because on my scan, they saw something on my liver. And it still was a laparoscopic surgery. And he went in and he did a small wedge section and actually scooped out. So there are 2 small lesions. Those lesions came back as necrosis of Anciner cells. I can't say that word, but basically, they were non-cancerous. We don't know. Did they show up? They showed up on my PET scan. That's how we knew. We don't know if it's because they had originally been cancerous and had died with the chemo. It's possible, but neither one of them were alive or malignant or having any problems. Um, we found one other lesion, and that was actually a little bit later on. But after we found the spots on my liver, and that was a second laparoscopic surgery. My surgeon, same surgeon, said, I didn't think that you were a candidate originally. He does a procedure called a HIPEC. It's a high intensity peritoneal. No, I can't remember. I can't remember what the E is, chemotherapy, but basically, it's an exploratory surgery, and they open you up. They infuse chemotherapy into your abdomen for anywhere from 90 to 100, and I think it can be up to 160 minutes. Then they drain it. They place a drain in your abdomen for fluid to continue to drain out. And they use this procedure for stage 4 cancer patients that it's kind of considered the last hurrah for some. Um, we asked him about it when I was initially diagnosed, and he didn't think that I really was a candidate for it. It is a procedure that he does, and there are not a lot of doctors that do it. So the fact that that's who I was going to, he had already been written up about it, particularly in this area, because he's the only one in that area of Florida, period, that does it. Um, he chose to do it, and we asked him, like, why now? Do you think it's worse? He goes, no, it's just that when I went in the second time, laparoscopically again, there are areas on the back side of your bowel that I can't see. He said, you had some scar tissue from where we had our first surgery. There was a little bit up against, again, the abdominal wall. I scraped that. I just want to make sure I'm not missing anything because I can't see all the way around the back end of some of your organs. I just want to make sure that there's nothing that I've missed when I'm in there. So he chose to do the HIPEC. I had the HIPEC done in April of 2020 during COVID in the hospital for 5 days by myself. That was a lot. That was a lot.
Yeah, absolutely. Going through the treatment and COVID by itself, outside of, having the diagnosis and needing to be in the hospital, that's a lot to handle for one person. And you said so many key things, Lisa. First of all, thank you so much for sharing your story. Um, I want to go back to when you said that you were having the pain, you went to the doctor, had the CAT scan, and it did not show anything. It showed colitis, right? Not cancer. I want to make sure everyone heard that correctly. Your doctor sent you to GI. The colonoscopy is what you had that picked up that you did have the colon cancer.
Yes.
I really want to pick up on that. Second thing you said that I want to just highlight is that your surgeon was a new surgeon,
Mm-hmm.
not very experienced, but you trusted him. He
Mm-hmm.
he he instilled the confidence and trust, and I think that's important because many times when we look for doctors or surgeons, we're like, we want the person who's been doing it forever. There's advantages and disadvantages to both, but someone that's new, they're up on technology, what's new. So I want to just highlight that. And you also said about your uncle who wasn't your blood uncle, that, and I think that's important when we talk about genetics and
Yeah.
genetic mutations and your risk of cancers based on your family history. So I just wanted to highlight those 3 points that you mentioned. I thought was so key for our audience. And through it all, you talked about your kids, and I know there's so many people that they don't want other people to worry about them. They want to kind of handle it on their own, and then disclose when they feel ready. When did you feel ready to disclose your diagnosis to your family, and how did
Um,
that conversation go?
well, unfortunately, it was over the phone, which you never like to do. I'm going to start with that one. So we waited until we actually had the tissue diagnosis and knew what our next steps were, because to tell them when we didn't know anything was my family. I love them. My husband says they don't have boundaries. They're line steppers. He calls them line steppers, actually, which means they step over that line. And they would start on this whole route. And without information that would not be helpful and can be more stressful. So I waited until we had the diagnosis and had an idea of what we were doing, what our next steps were, so that we could give them the information. And things that we couldn't answer because we didn't have that beyond that. Um, I had to do it very matter of fact because, again, I knew how they were going to worry. So I had to come to them with concise information. And this is what we're doing. This is how I feel. This is what's going to happen. Because they were already going to be reeling. And it's not that I had to be in control, but I had to be in control of this because I didn't need their extra anxiety. Um, so that was a lot. Um, I want to make a point about the young doctor. Young, but we had already looked at what he had done. And the fact is, we walked into this hospital. The magazine that was there had his picture on the cover because of the things that he's done. And he asked, he's like, you don't have to trust me. You're more than welcome if you want to get another opinion. And my husband looked at me, he said, "Are you good?" I said, "No, I'm okay. I'm good with him." And he does have it helps with their bedside manner. He did not ever act like I am the doctor and the surgeon and I know everything and you just need to listen to me. He was never that kind of person. So that was major too. He listened to my questions. Um, he didn't mind if I chided him on something. I did. I called him a coward on something. And he was like, yeah, maybe a little bit, so those things were helpful. It's hard. I want to make a point about CAT scans, that are very important. Colon cancer, as far as insurance companies go, do not require a PET scan. They feel that they can give all the information that they need through a CT. Um, and that is a CT, even if it is enhanced with dye. I would not be here today if we had just done even the enhanced CT. I wouldn't be here because there's no reason that a 2-inch mass was not picked up on a routine CT of my abdomen when it was adhered to my abdominal wall. So I fought my insurance company for PET scans. They refused to pay for them. I will tell you, whenever your insurance company refuses to pay for a test, go directly to the source. Ask them how much will it cost if I pay out of my pocket? What will my charge be? Because if your doctor feels that it's needed and you can come up with the money, do what is needed. We never ask. We insurance denies it and we just kind of go, okay, I had, I think, 4 PET scans before I moved to the CTs. And the only reason I moved to accepting and doing a CT is because of being asymptomatic and this far out on my survivorship. Otherwise, I never would. I still wouldn't. When they first suggested, okay, we can go to CTs and MRIs now, I'm like, are you sure? Because I'm not quite there yet. So fight for what is the best thing. I was also told that PET scans are not standard protocol for
Mhm.
colon cancer. I don't care. PET scans are what you need to initially sometimes find out where all of the cancer could be in your body.
Mhm. Mhm. Absolutely. That advocacy is so important, just in healthcare in general, but especially in oncology. You have to really fight for what you need and what is, what's required, what the doctor is saying is required to, you know, diagnose you, to treat you, whatever it is. And I always tell people it can be very intimidating, especially if you don't have a healthcare background, or, there's so much going on when you're diagnosed with cancer, but, finding an advocate that can come in with you and help you fight, right? You don't have to fight by yourself. So I tell people that all the time. All the time. So thank you for that. Lisa, throughout your journey, did anyone offer you or in your family, any support in terms of counseling, therapy, a social worker, anything like that?
Um, the social worker, not, I don't remember that part so much. But they did give me a list of, particularly through the hospital, of support groups that I could attend, um, and things of that nature. And it's not that I didn't need them. Um, I felt really good with the support system I had and have, that I didn't feel there was anything that I couldn't say. So I think a lot of times the reason that you need the support system is twofold. You don't want to say things to your loved ones because you don't want to burden them. You don't want to say things to people because they're not going to understand, because they're not going through what you're going through. And I understand and accept the validity of both of those in the need for support. Okay. Um, I was okay with the fact that they didn't understand what I was going through, but then neither did I. So I didn't feel that I needed to speak to others about that. And again, I was very fortunate that I did not have side effects. I think if I had a lot more side effects of things, I might want to reach out more to those that were experiencing those kinds of things in how you navigate it. What do you do? How do you emotionally handle that when you feel like your body is um, denying you? You feel like your body's failing you. Um, so I understand that. And I think that it's very important to have the outlet to be able to comfortably say how you feel. That's the time that I actually wrote things down. I I journaled during the time of me going into chemo. I stopped journaling when I was coming out of it, you know. Um, so that is how I handled it. I did write it out, you know, my fears, my anger. So that was my therapy. I'm a big talker. You see, I can be here talking and I have no problem expressing this, but sitting in a therapy group is not for me. And sitting in
Right,
therapy one on one for this problem, I've done therapy. I'm not saying that, but sitting
right,
therapy
right, right.
one on one for this was also not what I felt was going to help me. I didn't need to come to terms. Well, I need to come to terms. I always need to come to terms. But I didn't need help explaining where I was in my head on it.
Hmm.
But I
Hmm.
think it's extremely important.
Yeah.
Yeah.
Journaling is so powerful too, and I'm glad that you utilize the tool. So you had some sort of outlet where you were able to kind of um, really just put down your feelings and your thoughts at the time. So that's wonderful. So where are you now? What are you doing now?
Um, so I never stopped working. I still work. Part of me wishes maybe, but in my journey with this, I'm coming up on a milestone I've already gone past the first milestone. So my surgeon said two things to me. With the high pec, he said, we're giving you a clean slate on this. And I said, okay, well, what does that mean? And what are our expectations? He goes, My first expectation or my first goal is 3 years. Because though he's optimistic, we had to realize the fact that it's stage 4. And I was diagnosed shortly before the world found out about Chadwick Boseman being sick. And for me to realize that we have the same form of cancer. And when I look back, he died 4 years from the time he was diagnosed. I don't know what he did chemotherapy wise or anything like that. Because again, he may not have had side effects or such like that, like I did, and was able to continue to work and things like that. There was another actress that had been in Black movies. There was also colon cancer. She died shortly after him. Her time period had been about 4 years from the time she was diagnosed. Those things stick in my head because they're timelines that I have to exceed. So he said 2 things. One was clean slate. We're looking at 3 years first. The other is that he felt, given what he's already seen in my system, he said, I think that you're going to have little things that continue to pop up. But they're going to pop up, and we're going to catch them, and we'll get rid of them. And that's what we're going to do. And that's how I chose to approach it, that if something pops up, well, it's a hiccup, not the end. Let's get to 3 years, and then let's get to 5 years, because I know with even most cancers, you get to 5 years, your risk of, not the risk of it coming back, it's always at risk, but you get to relieve a little bit more. And I'm at going on 4 years from my last treatment. So come January, God willing and the creek don't rise, I will be at 4 years of survivorship. And I am currently at 5 years from when I was diagnosed. So for me, that's already a hurdle, because those that I looked at, and they never said it was stage 4, but I'm looking at the time that they were diagnosed and the time they passed, that it had to have been pretty significant. So I'm already kind of past that little hurdle. My next one is, like I said, is going for 5 years. And then after 5 years, I go, okay, well, then my next hurdle is 10 years. I take each step as an increment. I am also an advocate of, okay, if something comes up, what do we do? So I moved out of Florida for so many reasons. And but before me moving, I had already started seeking a second opinion.
Mm-hmm.
I started seeking a second opinion because my oncologist felt that she had reached the limit on what she could offer me. She had gone through the standard protocol. I had done 11 months of chemo. I actually had radiation for a mass that was found in the muscle wall and over my hip region. And it lit up. So we were assuming it's cancer, but nobody tried to biopsy it. We just went to radiation, which is also not standard protocol, which also my insurance refused to cover. Talk to your doctors, see how you can get things done without the insurance companies. Don't let them stop you if it needs to happen. And with her kind of going, I'm not sure what else we can try. I had already, because the veterinary world is a research world. I heard about
Absolutely.
Keytruda and it being used for colon cancer a good year
Mm-hmm.
before it was publicized that it's going to be used for colon cancer.
Mm-hmm.
And I had a friend who said, talk to your oncologist about Keytruda. and she didn't know about it and she wasn't comfortable using it then. Um, I kind of kept going, like, this is an option. They say it's got really great results, the research shows. She gave me a dose of Keytruda. I did fine with it, but my liver didn't like it. I never was clinically ill, but my liver enzyme went through the roof. And then they placed me on steroids and everything like that because of concern for that way. I gained weight. I'm the only person going through freaking chemo and I'm getting heavier rather than losing weight. um, but after that, she was then scared. She's like, I'm not sure what's going to happen. And, because of your stage, we expect for it to come back. That's the one thing that always sits in the back of my head, is that there is that expectation when it's stage 4 that it will rear its head again. So when she said she wasn't sure and she wasn't comfortable using Keytruda again, that's when I started seeking second opinions. And I had already been in contact with a doctor in DC. And then we moved to Philadelphia and I got in touch with oncologists here in Penn. And one of my first questions was, okay, this is what happened. You had my record. This is what happened. This is what my oncologist said. But I'm asking you, what are our choices? I know I'm fine now, but what do we do when this demon decides it wants to kind of show its head? Because we also all know when cancer rears its head again, it's really pissed off and it comes back with a vengeance. So we need to stay on top and not let that happen. And where I am right now, they said that we have options, that we have things that we can try, including trying Keytruda again. So being proactive, I'm not resting on my laurels, you could say, of being a survivor, um, because the time's not enough. That's one. Two, I have to be proactive because I'm not going to be caught off guard.
Yeah,
I
I think that's key. It's key because what are the options? There are options. And I want to ask, was clinical trials ever an option, or is that on the table?
Clinical trials were a consideration moving forward. They weren't a consideration initially because there's a pretty set standard protocol. We did all the genetic testing though. I mean, they look at the genetic testing of the tumor itself. They still don't feel that mine's hereditary. They're not sure where it came from. Um, but knowing this, I have a son that I actually gave birth to, one I didn't. The one I gave birth to, I said, I don't care what your doctors say, you're starting your colonoscopy at between 35 and 40. You're not waiting until you're 40. You're definitely not waiting until you're 50. I said, and you tell them your mother, you know, had stage 4, and 18 months before she was cleared. So this is not something we're playing with. But, in doing that, having those options, making sure that you stay on top of things. I'm at a point right now where I am being monitored every 6 months. I'm okay with that. And we do CT and MRI. Um, we do my chest and my abdomen. Um, there have been no changes in anything. There's no lesions that are seeing. There's nothing that's grown. It looks the same from one to the next at this point. And then we also are the things that you don't know, checking cancer marker cells in your blood. That's part of my protocol. And it's not that they're looking for this cell says that it is colon cancer. No, there's actually a cancer marker cell in your body that if it's elevated, it should be a red flag that something is going on, even if they didn't find anything else. And mine's been very low. So these are the things that we are doing. And every 6 months, I'm scheduled now to end of September. So I go September and March right now. And then in between that, I try and work on the things that I need to lose weight. Like who doesn't? But I need to lose weight. But that's also a mental problem.
Mm-mm.
This I could lose weight. I do exercise. I know the right things to eat. I can lose weight. It's not that I can't. Your mind over matter is so much, and my mind keeps stopping me because I know I associate weight loss with being sick.
Mm-hmm. Mm-hmm.
So I'm trying to work past that. Now that might be where I need the therapy. you know. So I'm
Yeah.
trying to continue to work on that part. But I walk, I exercise. I was actually thinking about going swimming today. I do the things. I exercise in the morning and I try and watch what I eat and stay away from sugars. Sugar, cancer loves sugar. It does. Less
Yeah.
sugar in your body, less artificial sugars, less white sugars, all those things are less for cancer to feed off of.
Yeah.
So, yeah, I try and work
Yeah.
on those things.
Yeah. I love that. Lisa, I want to ask you a question before we wrap up, but what brings you joy today?
oh, um, my family.
Yeah.
It really does. My family. Um, I lost my brother after I moved home suddenly, and still devastating, very hard. um, but my sister's still here. My husband, my sons drive me crazy, but and then other things. I meet with Black Girls Run on Thursday mornings.
Mm-hmm.
I don't run as well. My sister runs faster, but it's meeting up with them. Um, Trying to be active in different community things. I love doing jewelry. I love working on jewelry. Um, I love reading. I'm in a book club with a with all older white Jewish women, but they pull out some great books,
Yeah.
you know. And it's those things that take my mind off of everything else, you know. Um,
Yeah. You're still living.
yeah,
That's it. You're
yeah,
still living. You're still working. You're still going to events. You're
yeah,
still engaged in the community, which is amazing. That's what it's about. I mean,
yeah.
whether you have cancer or not, but that's what it's about, and you're doing it. So that's
Right,
amazing.
and
That's amazing.
that's what a lot of it is. I, part of my survival or my coping mechanism, rather. I said this. I think I said it to you. Is denial. Now, that's not necessarily a good thing. I recognize that that's what it is, but what it has helped me do, it's helped my mindset. That's what I
Mhm.
will tell you.
Mm.
Um, I deny that this is really going on. So I keep doing the things that I want to do that make me happy, that I can do. Like one doctor actually asked me, "Why are you still working?" And I was like, "Why not?"
Right.
To
Right.
me, not working would have been giving up.
Mhm.
Not working. They're like, "Why didn't you retire and live your life?" I'm like, because I plan on living my life. But not working when I feel okay, to me is like giving up, and I'm not ready to give up.
Right.
So
Right.
I'm
Absolutely.
I'm going to keep going. Um, so it is a form of denial. I recognize it. I know what it is. Um, but I don't deny taking care of myself. I just deny that this is actually happening inside my body. I'm like, nah,
Right.
it can't be. It can't be.
Yeah.
So,
Yeah. And before we go, what is one thing you want to leave with our viewers and listeners?
everybody's journey Yeah. There was I heard somebody say once, everybody's an expert in their own experience. And I found that very poignant because no one can tell you exactly what you're going through, exactly what you're feeling, exactly what you have to do. Everybody's journey is unique. But what I will say is continue to make the journey. Don't allow yourself to be so crippled by what might happen that you also speak it into fruition. You have to you have to be afraid of it, but don't let it stop you. Ask the questions. See how it can happen. See, fight until you can't fight anymore. Um, and that means sometimes you don't want the drugs. And I can understand when people say, I'm not going to do the drugs anymore. Then you've fought until you couldn't anymore. I understand that. But until that time, try and do everything possible to remain here.
Yeah, absolutely. Well, thank you so much, Lisa, for sharing your story. This has been so empowering. Thank you so much.
Thank you. I appreciate it.